Good afternoon. This is Dr. McDaniel back at GYN Corner, and I hope everyone's having a pleasant Tuesday afternoon. It's a-okay here in New York City. It's overcast and raining. Yeah, it's still raining outside, so it's overcast and raining today in New York City, tri-state area. So I trust other places in the country and the world are having better weather than we are today. But hopefully, since it's late June, it will pick up. So as the information presented, I'll be speaking on breast milk when there's no baby. Yes, that can happen. Breast milk when someone has not been recently pregnant and they don't have a baby to suckle. I get this question from time to time. Someone will say, is it normal for me to have like breast milk or milk that comes out if I squeeze my breast, even though I'm not pregnant and I haven't had a baby? So the quick answer is no, it's not normal to have breast milk when there wasn't a recent baby. That seems obvious to me, but it's not always obvious. So it's not normal to have breast milk if you haven't recently had a child, but it can occur. Now, breast milk or milk that's extrudes or is what's the word called, expulsed from the breast, any kind of milky discharge or nipple discharge is what we call it, is called galactorrhea. Galact means milk and rhea means to run, so running milk. Galactorrhea is any kind of nipple discharge, but it's usually a milky or white nipple discharge. It can occasionally be a bloody, a clear, a yellow, a green. It can have different colors or different presentations, but it is any kind of liquid coming from the nipple. It can be expressed, which means that that person or someone else is squeezing the breast and they're producing that discharge when they squeeze. So it can be expressed, or it can be spontaneous, where just suddenly the breast is leaking. Either way, if someone's remote from a pregnancy, so more than 2 years from a pregnancy, or they are further out but they're not continuing to breastfeed, then it's not normal. The evaluation for that can be quite extensive. The first part of the evaluation will be a history, because certain medications can cause the stimulation of milk production. Milk production is due to a hormone. That hormone is called prolactin. And prolactin comes from the brain, the pituitary gland in the brain. So anything that can potentially stimulate or allow for the overproduction or the decreased clearance of prolactin in the body can cause elevated hormone levels and subsequently milk production. Now, primarily what we'll do is we'll get a history to see if there are any psychiatric medications, because quite a few psychiatric medications can cause an increase in prolactin levels because they decrease another hormone, dopamine, which helps suppress prolactin. So quite a few antidepressants, quite a few antipsychotics, some of the anxiety medicines can allow for prolactin levels to increase. So common ones are Xanax, Zoloft, Prozac, some of the antipsychotics, metoclopramide, Reglan, Buspar. A lot of the psychotics, antidepressants, anxiolytics. So a lot of the psychiatric medications can cause or allow or actively increase prolactin levels, which will be the source of increase or the production or the stimulation of milk in the breast. Kidney disease can also do it because it decreases the clearance of the naturally produced prolactin, so it allows for an increased production. Thyroid disorder is another one. So hypothyroidism allows for elevated prolactin levels. Drugs, marijuana use, frequent or chronic marijuana use can do the same thing, allow for prolactin levels to elevate. those are all of the stimulants. So medications, some of the high blood pressure medicines too. So antihypertensives can also allow for increased prolactin levels. So when someone first expresses or admits that they have nipple discharge or milky discharge, any kind of leakage from their breast, or that they will see a leakage from the breast if they squeeze them, the first thing to do is to check to see what medications they're on, and one by one eliminate those medications to see if they have an effect. Then the second thing to do is to see if they have any recreational drug use that can affect the prolactin. Marijuana is pretty much the only one that I'm aware of, pretty much the only recreational drug that can potentially cause nipple discharge or leakage or milk production. After that, you want to see if they have a medical condition. So you want to check for a kidney disorder that can cause it. You want to check for hypothyroid, so a thyroid screen. You obvious to me, but it's not always obvious, you want to check what their prolactin level actually is. So is the prolactin level elevated? So those are the blood draws. And you'll want to also check to see if they're pregnant. Some women will have a pregnancy that's undiagnosed, or they'll have a disorder that causes that pregnancy hormone to rise. There aren't many, so pretty much the only two, if someone's not pregnant, that will cause a pregnancy hormone, which is human chorionic gonadotropin hormone, or the HCG. That hormone will rise with pregnancy, but it will also rise with an abnormal tissue variant called gestational trophoblastic disease, or hydatidiform mole, or choriocarcinoma. Those are placental problems, so cancers and precancers and abnormal growths when there isn't actually a normal pregnancy. Or a teratoma, which is an ovarian cyst, can very rarely, but it's still a possibility, it can rarely produce HCG. And then that HCG hormone, as it rises, will stimulate prolactin levels. If the prolactin hormone or that level is normal, that person does not have a thyroid disorder and they don't have a kidney disorder, then it's also possible that there is overstimulation, manual overstimulation. So if someone is constantly squeezing their breast, doing breast exams, checking to see if there's any kind of discharge or nipple leakage, or if sexually there is frequent daily excessive suckling by a sexual partner of the breast, that can also increase stimulation through a reflex, a nervous reflex, a nerve reflex that can stimulate nipple discharge or leakage from the breast. So someone can do that stimulating with manually or with suckling, or it can be due to damage. Any nerve damage on the chest wall can also potentially stimulate nipple discharge or leakage from the nipple, because that nerve stimulation can cause the ducts and the glands to locally produce milk. It can also be due to a mass or a growth. That would do the same thing. A mass or a growth will stimulate the nerves at the end organ, which is the breast, to produce leakage or a milk production. Obviously it's not real milk, but it's an abnormal fluid production from the glands, which will have a milky appearance. Now if the leakage does not have a milky appearance, if it looks clear, or if it looks bloody, or if it looks green, those are worrisome. They should always be evaluated, because those are more commonly going to be produced by a mass or a growth that can have damage, cell damage, or tissue damage, and those discolorations are due to the tissue or cell damage. So in that case, a woman should always see either a gynecologist or a breast specialist, a breast surgeon directly. So as a recap, any kind of nipple leakage or discharge or breast milk when someone's remote from having a baby is abnormal and should be evaluated. First, by determining if there's medications as a cause or drug use as a cause, if there's a mass or a growth, or if there's a hormone elevation due to an undiagnosed pregnancy or due to hormonal conditions that can increase that pregnancy hormone, a cancer, a precancer, a mass, a growth, or an ovarian teratoma. Those can all cause that hormone to be elevated, or if there is chest trauma or nerve stimulation, a mass, a cyst, or a growth directly in the breast. So I'm going to end the presentation today on those aspects. I'll be back tomorrow with a recap on those, and then how we specifically evaluate, diagnose, and what the treatment and management will be tomorrow. Thank you for joining me today at GYN Corner. Please check out the YouTube channel. That's also GYN Corner. This is Dr. McDaniel. Have a great rest of the day. Thank you for joining.